Thank you for having me today, and thank you for sitting and being so patient and having the attention span that you do. It's not easy to sit through lots and lots of hours of conversation and discussion around something that is a really difficult topic. So I'm Selin. I'm a dietitian. I work at Guy's Hospital, and as you can tell from my accent, I'm Australian. So I do apologise if you can't hear me very well or understand what I'm saying very well. I will try my best to enunciate my words as much as possible. But being an oncology dietitian, we have seen lots of cancer cases and we've seen lots of different myths come up surrounding this topic. So this is the time and place to discuss all of that. Because we have so much to talk about, I'll do my best to cover the diet side of what I'd like to cover, and then we can have some questions at the end. I imagine that lots of these questions might be answered through this presentation, so let's sit tight and do our best to do that together. When it comes to diet though, I would say that it is probably the first thing that many people think about when they think of a cancer diagnosis or when they get that initial cancer diagnosis. When we think about what we can control and what we can't control, a lot of the time we think about diet. What should I eat? What should I do? So let's talk about that a little bit more. The first thing we'll talk about is the role of nutrition before, during, and after treatment, because nutrition and your requirements will change in different stages. And of course, this will be very individualized because of the treatment options, because of the surgical options, or perhaps it's chemotherapy or radiotherapy or whatever your treatment might be. It will be different for everybody. Healthy eating and healthy lifestyle recommendations. This will be across the board for everybody. Again, this will be individualized. Commonly asked questions, diet myths, and then any other questions that you may have. Okay, so what does eating well mean? And eating well, when we think about what we often see on TV or the news or on the internet, it encompasses so many different things, but I'd like to just focus on eating well when it comes to cancer. Reducing stress and anxiety related to eating is a very big part of what we do. There's a lot of anxiety around what we should eat, what we shouldn't eat, what we can control, what we can't. Maintaining energy levels and strength is a really key part throughout your cancer experience. Maintaining a healthy weight, this is really important. Essentially, what I often get, and we'll talk about this in more detail in a few slides, what I often get is, right, this is the time to lose weight. It's not the time to lose weight. And we'll talk about that again before, during, and after treatment. Eating a balanced diet and what that looks like. Enjoying what you eat and drink. Many times I get patients who are self-restricting very, very much so, and it can take away from the joy of life. And it unnecessarily so as well. So we will talk about that as well. Supporting the immune system is really key. And so, like I said, all of the dietary advice that we give to each of our patients will be individualized based on you, your cultural differences, your diagnosis, your experience of treatment, your symptoms. Sometimes some symptoms are a bit worse than others to manage, and your experience will be different to the person next to you, which will be different to the person next to you. So lots of things to think about. A really important aspect is that there is a huge amount of unregulated information on the internet. Essentially, when you search up diet and cancer, I think it's something like 80 million different search results come up. Whether or not they are from sources that are government bodies or sources that are anecdotal, blogs, etc. How are you supposed to differentiate between what you should listen to and what you shouldn't? It can be quite tricky, but that's what we are here to do. Being a dietitian, working in the oncology team, that's what we are here to do. We are trained in this area, and research is really important. Research does come in different shapes and sizes, and sifting through the research can also be quite tricky. But again, that's why we need research, to have a conclusive piece of evidence and say, right, this is why we believe that you should follow X, Y, Z, because we've got research to back it. So it's not just about, well, my experience is this, and so you should follow me because my experience has been X, Y, Z. Well, what about the wider scope kind of thing? So we've got to think about the research backing some claims as well. So a role of a dietitian in your care. What I do is a myriad of different things to support my patients, and so do the rest of my colleagues as well. Nutrition support does come in different shapes and sizes. Managing any symptoms that you might have is a really key part of all of this. Symptoms like loss of appetite, maybe loss of taste or desensitized taste, maybe some other symptoms like oral thrush. You might have symptoms like mucositis, which is where your esophageal tract gets inflamed and it can be quite painful to swallow. Maybe other things can happen, like a blockage in certain sites. Maybe you've got constipation or diarrhea. Lots of different things that can happen as a result of your treatment that we need to think about from a nutrition perspective. Increasing your oral intake. That sounds like a bit of a strange one there, but basically eating more. Eating more and eating the right things and eating in a balanced way. It's not, again, the time to go on a diet or to lose weight. We've got to make sure that you are nutritionally fed. The better fed you are, the more fit you are for treatment. And balancing nutrition, of course. Oral nutrition supplements. We've got lots of drinks available to help you during the times when your appetite might be quite poor. Maybe, again, you're unable to tolerate different foods that you could tolerate before. Maybe foods taste off. They just don't taste right the way they used to. The foods that you used to enjoy, you don't enjoy them anymore. Maybe, again, the swallow difficulties inhibit you from eating the way you would normally eat. So oral nutrition drinks are really quite helpful in these instances. Artificial feeding as well. Artificial feeding can sound a bit scary when you don't really understand what it really entails, but artificial feeding is there to essentially support you. It's another element of nutrition support, whether that's short-term or long-term. And so some of my patients, again, if they have difficulties with swallowing, if they've got a blockage on certain sites, perhaps if, again, they've got something like mucositis where the esophageal tract is quite painful when they swallow, then it could be really tricky to meet your nutrition requirements. So we often do something called a nasogastric tube feed. So that goes through the nose and into the stomach. And until that esophageal tract feels a lot better, a lot easier to swallow, that artificial feeding will help to meet requirements. Again, when we think about a tube or being in hospital with a tube, it is a really scary thought. And it feels quite scary to think about. It's really not as scary as it sounds, or the visuals that might come up when you think about that as well. And again, it could be short term until the issue resolves, or it could be a bit longer until you feel like, right, I think I can meet my nutritional requirements by myself again. Then there's myth busting. A lot of what we do is myth busting as well. Lots of myths, lots of questions come up around nutrition. Weight management, which again we'll talk about, and survivorship. So I will do my best to get through lots of different elements of diet. So again, some of the nutritional impacts of treatment. As I mentioned, nausea and vomiting are some key common ones. Who's experienced that one before? Yep. And that could be a bit of a double-edged sword because your nutrition requirements go sky high, but your appetite's quite poor. You've got nausea, perhaps you've got some vomiting, and you're not able to meet your requirements. So on one end, it's a bit of a double-edged sword. You've got higher nutrition requirements, but you can't meet them as well as you would like to. Feeling of fullness or loss of appetite. Taste changes, who's experienced that one before? Yep, got a few nods. Changes in your bowel habits, maybe you've got really loose bowel motions, or maybe you're quite constipated. This can be quite tricky and it can affect your quality of life. So lots of things to think about on that end. In terms of your nutritional implications, your reduced appetite again means that you might not be able to meet your requirements. You might be losing weight. We don't want you to lose weight. This isn't a time for that. The better weight status that you have, the better you'll respond to treatment. We don't want you to be too thin. We don't want you to have no nutrition stores. We want you to have good muscle mass, but also a good amount of fat mass as well. Especially when we think about post-chemo or post-radiotherapy, when you do lose your appetite, when you're feeling really fatigued. Again, this experience is going to be different from one individual to the other. Some people might not experience these symptoms as much as others. But if you do get hit with that fatigue, that loss of appetite, that loss of taste, perhaps that lasts a good week. Perhaps that only lasts a few days, but that's a few days of little to no nutrition that is going to have an impact. So we do need to make sure you're nutritionally fit before treatment as well. And then management. We like to manage these symptoms, all those bowel motions, the nausea, vomiting. We do have a good relationship with the wider medical and health team to make sure that we're managing these really disruptive symptoms and your quality of life as well. Okay, so in terms of our cancer prevention recommendations, there's lots of things to think about here, and I'm going to go through most of these here, the ones that are relevant. These numbers sound quite arbitrary, and I don't expect you to look at them and go, oh, I understand exactly what that means. In terms of a body mass index or BMI, this could be a bit of a tricky concept. Essentially, we don't want you to be underweight, and we calculate this using your body weight divided by your height and things like that. That's what we do. You don't have to do that. We want you to be in a healthy weight. Overweight is also fine. In terms of being in the higher, or what we call obese weight range, we don't tend to want, again, for you to lose weight in any of these categories. And again, it seems like a bit of an arbitrary number for me to bring this up, but we do need to emphasize that a healthy weight is one of the ways that we can prevent cancer. Now, we aren't here to talk about preventing cancer. We're here to talk about treatment, and we're here to talk about management. But in terms of some of the recommendations around it, this is our pre-recommendations, and then during our treatment and management, we want to maintain our weight in these statuses and talk about weight gain if we are underweight. In terms of your waist size and circumference, again, we do want to make sure that we're not holding excess weight around our abdomen. And again, this is something we can talk about in your consultation with a dietitian or with your medical team or your wider team. But essentially, one of the really key factors we have to think about is being a healthy weight to prevent cancer. But if we are going through the treatment, we want to maintain that weight. So I know I keep emphasizing the same thing over and over again, but weight is really important to us. Physical activity. So Denise did a really good job in the presentation just before mine to talk about physical activity. We do encourage physical activity wherever possible, but a really important part is when you're going through treatment, you're not going to feel the best. You're going to be fatigued. Perhaps you're not meeting all of your nutrition requirements. Doing your best to be active or move is going to be a really important part of both stimulating your appetite, dealing with some of your symptoms, giving you a bit more energy as well. Lots of different ways that diet has a flow-on effect into the other aspects of your management as well. And again, limiting sedentary habits. These guidelines are geared more towards preventing cancer, but we're in cancer right now. We're talking about management and treatment. So we do need to talk about how it's okay for you to be fatigued and tired and not do as much as you used to do, which is perfectly fine. But again, doing your best to have some movement will always be quite helpful. So the Eatwell guide, I will talk about some portions of this and how this relates to cancer as well, because the Eatwell guide isn't just there as an arbitrary, pretty looking picture. There's lots of evidence to back why these are really important recommendations. Starchy carbohydrate foods. So when we think about carbohydrate foods, who gets a little bit scared of that word, carbohydrate? A little bit, yeah. When we think of carbohydrate, what's one word that kind of sticks out to you? What's a word that might come up? Sugar. Yeah, yeah, sugar's a really common one that comes up. Carbohydrates they do encompass sugars. Sugars do come in different shapes and sizes though. Lots of different bonds between lots of different sugars. A sugar found in a fruit, for example, is going to be different to a sugar found in a bean, is going to be different to a sugar found in a gummy bear. So with all this in mind, let's talk about starchy carbohydrate foods, the ones that we recommend. Fiber is key for women especially. Fiber is key. We're talking about wholemeal breads, cereals, oats, pastas. There's lots of legume pastas as well now. Potatoes with the skin on. In fact, with potatoes, 50% of the fiber is on the skin, not on the inside. Or, well, I mean, 50% is on the inside too. Brown rice, noodles, yams, etc. These are really fiber-rich sources of carbohydrates, and they're really quite beneficial. And it has this role in terms of helping your, of course, bowels move, but also has this role in when we have all of our byproducts that build up, it goes to the bowel to be excreted. Fiber helps to push all of that out. We don't want all those things to stay in our bowels for too long. It can cause discomfort. It could cause, in some instances, for those byproducts to be reabsorbed by the body. And we don't want that to build up in the body. So we do want to include at each mealtime something along these portions, 4 to 6 tablespoons of cooked pasta or rice or a breakfast cereal. That doesn't sound like much. So when we say one portion looks like this, likely your one bowl of cereal will encompass maybe 4 portions. So you're sort of meeting your requirements in this way. 4 egg-sized potatoes or 1 jacket potato is also a nice portion to think about. 2 medium slices of bread, etc. I'll leave some of the portions for you to have a look through in your handouts, just because we have so much content to go through. But in terms of the nutrition side, fiber is the one I really want to push here. Calcium, iron, and B vitamins, all really important. B vitamins are really important for your energy production. Calcium is especially important for postmenopause, and calcium's best friend is vitamin D, which we'll also talk about in a moment. Iron is also especially important for fatigue control, fatigue management as well. So again, opting for the whole grain, whole food properties, whole foods properties. Fruits and vegetables. Who thinks that fresh is better than frozen? So fresh and frozen are almost completely comparable to one another in terms of their nutrition properties. And it is a big question that I get asked. And in fact, sometimes frozen is a bit better than fresh because it's snap locked, and that nutrition is snap locked as well. They could be more affordable, better in terms of their nutrient profiles, because lots of vitamins like vitamin C is heat and light sensitive. The more an apple might sit there for a week, for example, the more it's likely to deteriorate in some nutrient profile considerations. So fresh and frozen, while they are comparable, frozen is oftentimes almost a little bit better. But again, perfectly fine to choose either or. We always like to opt for 5 a day, as much as you can with your vegetables, obviously the better. But 1 medium piece of fruit, so what can fit in the palm of your hand, is a good measurement to opt for. 2 small-sized fruits is also fine. 1 banana, maybe 2 small mandarins. Dried fruit is also, oddly enough, a really good source of iron. For example, our apricots. But those are all conversations we can have more face-to-face, because I do want to make this a bit more geared towards your management and treatment. But in terms of their nutrition benefits, they're very high in vitamins, of course, minerals, low in fat and high in fiber. We like the peels. The peels are great. Peels are full of fiber, and fiber comes in different shapes and sizes. There's the insoluble and the soluble. The insoluble is what we consider to add bulk to your stool, and that is going to help things move along. Then we've got our soluble, which kind of is a bit more jelly. So we like both of these. Both of the fibers are really important. One of the symptoms you might get from your cancer is that you might have a blockage, whether that is a gastric outlet obstruction or a bowel obstruction. And in fact, does anybody have that experience, or has anybody had that experience? Yeah. In these instances, the insoluble fiber is going to be removed. We don't want the insoluble fiber. We only want the soluble one. So we don't want those kind of bulky matter to build up anywhere. We want things to pass along and glide along quite well. And again, everybody's management and treatment is going to be different. So if you have had an experience like a bowel obstruction or a gastric outlet obstruction, then your management is going to be very different in terms of surgical options and things like that. So, or whether that's conservative kind of management, which means dietary management without going through the surgical route. So again, lots of individualized considerations to have, but if that is not an issue for you, then we do like fiber. And we like fibre with gastric outlet and bowel obstructions as well. We just like to remove the bulky bits. Protein-rich foods. So protein-rich foods, we often think about meats, which is perfectly fine, but they do come in different shapes and sizes as well, like eggs, like milk, yogurt, pulses, nuts, things like that. And of course, meat alternatives. Meat alternatives is a bit of a contentious one. Personally, I don't like the meat alternatives because they are highly processed, and we like not to opt for things that are highly processed. When we think about processed foods, there's a spectrum. There's the whole food, fruits, vegetables, grains. They come completely unprocessed. We start processing them, we get some breads, cereals, pastas. Then we process them a bit more, and then we get something like sausages and salami, things like that. And then we've got, the really ultra-processed things like our crisps and our perhaps mock meats and things like that. So there is a spectrum, and we do like to balance it. Doesn't mean completely stay away from ultra-processed foods, but we don't want to make that our core foundation of protein either. So recommended portions, 2 to 3 portions a day, sometimes even more, depending on, again, your stage of treatment and what your experience is. We need to maintain your muscle mass. That's a key factor here. When you're going through treatment, oftentimes you'll start to lose a bit of your muscle mass because you are going to be fatigued. Perhaps you're not going to be moving around so much. Maybe your appetite is poor. Maybe you're opting for foods that are a little bit more palatable, and protein perhaps isn't one of those foods. So we might lose a bit of protein, a bit of muscle. We don't want to do that. Unfortunately, it can be quite tricky to regain that muscle when we're feeling quite poorly as well. So again, individualized nutrition care can be applied here, but that is part of our role as well, to make sure that we're maintaining your muscle mass. Okay, so some top tips as well is to limit our consumption of red meats. Now, red meats do play an important role. They are full of iron, B-complex vitamins, and are packed full of protein. We like the lean versions, and we recommend having 2 serves of lean red meat a week. We don't want to increase that too much, and we don't want the processed meat side of things, so the salamis and the deli meats and perhaps the fattier portions of the meats and pork belly and things like that. We do want to minimize that side of the meats. Beans, an alternative source of proteins though. Beans, legumes, fantastic, really beautiful nutrient profile as well. Portions for main meals. So again, we don't want weight loss right now. We want weight maintenance. And when we think of weight maintenance, we want our plate to look something like this. Whole grain carbohydrates, vegetables and fruits, lean proteins, making up 1/3 of your plate. When it does come to weight loss, this is more of a post-treatment consideration. You're post-treatment, you're not going through these really disruptive symptoms. You might think about, okay, maybe I do want to lose a bit of excess weight that I've gained, whether that is because I'm not moving around so much, or because I've lost muscle mass and gained a bit more fat mass, maybe because I've had surgical menopause, or maybe because menopause has inhibited some of my metabolism, and so on. Then we can think about weight loss. I won't talk about weight loss in this presentation, but just one of the considerations to have is that if that is something to think about, then our portions do change slightly. But again, we can talk about that afterwards as well. Milk, dairy, and alternatives. Who has heard something about dairy or staying away from dairy? Yep. Not being sure if dairy is appropriate when it comes to cancer. Yeah, I'm getting some nods. Dairy and alternatives. These are perfectly fine. It can be very frightening to sift through information on the internet because it sounds terrifying. And I've seen it as well. And when I read it, I think, oh my goodness, that sounds terrifying. And then I go, hang on a minute. It's not actually backed by research. We do use research to guide us, and dairy and alternatives, they have really beautiful nutrient profiles. For example, butyric acid, it's got a bit of an antioxidant profile to it. They contain vitamin A, B12, vitamin D, which is my favorite nutrient, and we will talk about that in more depth as well. Really important nutrient benefits here. And soya drinks, we'll talk about soy as well, or other milk alternatives are great ideas as long as they are fortified. Oftentimes, dairy alternatives won't have the same nutrient profile as dairy, so we've got to make sure that they are fortified or those nutrients are added in. So again, dairy, iron, B12, these are some of the ones I look for when I look at the nutrient panel. All right, sources of calcium. Calcium is a really important consideration when we think about menopause and when we think about bone health in general. Calcium is going to maintain your muscle and bone strength and health. In terms of source of calcium, so we want to aim for something like 1,000 to 1,200. In fact, let's go for the 1,200 milligram mark per day, especially post-menopause, whether that is because of surgical menopause or natural menopause, and so on. Milk is a very good source of calcium, as you can see, 240 milligrams. And again, we do have to build this up through the day. So having one glass of milk is not going to meet your requirements, but then we can build it up by having a bit of milk and a bit of yogurt and a little bit of perhaps calcium fortified desserts or something like that, maybe a bit of custard. So would you like that? Sardines with bones and anchovies are a great one. They are quite high in calcium. However, vitamin D is more essential, I would say, than calcium, because calcium is retained in your bones. When you start losing calcium is when you're not using your muscle as much. So we're not tugging against the muscle, against the bone. If you're not tugging against the bone, then your bones go, oh, I'm not needed, so I'll just remove my calcium. What we want is to constantly knock on the door of your bones so that they go, oh, no, we're retaining our calcium. Oh, no, yep, we're awake, we're here. Okay, calcium can stay in the bones kind of thing. Because that's what muscle does. It kind of tugs away at your bone and it kind of wakes up your bones in a way. The role of vitamin D is essentially to keep that calcium in the bones. And we will talk about that in a moment as well. Because vitamin D is my favorite nutrient, it is essential for calcium and phosphorus absorption. There's 3 nutrient considerations: calcium, phosphorus, and vitamin D for healthy bones. And so when we think of vitamin D, it is a vitamin, but it's also a hormone. When we get our food sources of vitamin D, for example, from our eggs, they are usually the form of vitamin D2, which is not active. When it becomes active is when it becomes vitamin D3, when it gets converted into D3 by the sunlight, so and through your kidneys and things like that. So it goes through quite a bit of a process. Now, your supplements will all be vitamin D3. Sometimes your eggs will be fortified with vitamin D3 as well. But essentially, most of the vitamin D you'll find is going to be through access to sunlight. That is going to be between April and September. That's when you get higher vitamin D levels, and your body kind of retains that through the winter months. However, I always recommend a vitamin D supplement through these winter months because it's usually not enough to sustain you through winter, is number one. And number two, we have to also consider pigment of skin. If you have lighter skin, it's going to be a lot easier for you to gain that vitamin D. Once you start getting a bit more, when you start having a bit darker, when you start getting a bit darker skin, when you have darker skin, then you need higher levels of vitamin D, higher exposure to sunlight. Again, through the times of the day that are a bit more appropriate so that you're not being unsafe around the sun as well. But yes, you will need higher levels of vitamin D. So about 15 minutes of sun exposure is usually perfectly fine to provide enough vitamin D for the year, is what we say if you've got light skin. You will need more if you've got darker skin. My skin I'm trying to think of the staging of the skin. I think I was something like stage 3 because of my Mediterranean roots. Means that I need something like 30 to 45 minutes in the sun. But again, this changes from person to person and where you are in the world as well, because the UV rays also change in terms of their intensity. But of course, important to protect your skin as well. So again, important considerations to consider here. Let's talk about where to find vitamin D. Oily fish is our best friend. Our sardines, anchovies, herring, mackerel, And I mentioned sardines already. Cod liver oil. These are fantastic sources of vitamin D. Margarines, eggs, and breakfast cereals have very small quantities, but again, you can find them through food sources. These are almost inactive until you get that vitamin D from the sunlight, until your kidneys convert them into the active form. So while the aim is for 400 to 800 IU of vitamin D daily, this is still a very small amount. I would still recommend having something more like 1,000 to 2,000 just because we need to build it up through the year regardless. And again, especially if we have darker pigmented skin, and sometimes we don't know if we have darker pigmented skin until we go through a dermatologist or something like that, or we speak to our doctor and they say, actually, you do have a little bit of a darker tinge, and so you might have higher vitamin D requirements. Okay, and also the Eatwell guide, I do want to mention that while the crisps and the oils and spreads, they are on the outside here, we don't want to include them as much. When you're going through treatment, sometimes they are all that's going to be available to you in terms of stimulating your appetite or in terms of snacking. So if you are feeling quite nauseated, if you are vomiting, if you are really struggling, of course, speak to a dietitian and we can do our best to support you. But perfectly fine to go for your chocolates, your biscuits, your milky custards and ice creams and things like that. We want to sustain you. So it's a balanced approach. What we recommend before treatment, during treatment, and after treatment is always going to be a little bit different and individualized. Alcohol. So it is best not to consume alcohol at all. It does have a deleterious effect on lots of parts of your body and in terms of your hormonal profile as well. However, the national guideline is to have no more than 14 units a week, and 1 unit looks something like 1 small shot of alcohol. Sometimes it could look like a half pint of beer, but my recommendation is always to remove alcohol completely. Sugary drinks. This one is a bit of a shock, but what you can see here is the amount of teaspoons in each of these drinks. Significant, and they really do build up through the day. Even flavored water has something like 5 teaspoons, and the recommendations for added sugar, again, not naturally occurring sugar, but added sugar through the day is no more than 5 teaspoons. So you would have met your limit by just having 1 drink of this bottle of water. Pardon, not 1 drink, 1 bottle. And then going to something like Coca-Cola, that's 11 teaspoons. That's a significant amount. So sugar can build up quite significantly through the day, especially if we think, oh, yep, I'll have a flavored water, and then I might have some biscuits and I might have perhaps a bit of custard and ice cream and things like that. Again, perfectly fine. However, we do need to have a balanced approach. So just a consideration here. And again, it does contribute to excess weight gain as well. And we do want to avoid that when we think of prevention and then post-treatment as well. Supplements. So we always go for a food first approach with dietetics. We can meet your nutrition requirements through the diet, so we will aim to do that first. We don't necessarily recommend them for cancer prevention or post-treatment. In fact, some of these supplements can interact with your radiotherapy or chemotherapy agents. So it's really important that you bring up any of the other supplements that you're taking to your doctor and to us as well. Avoiding large doses is really important because of this reason, but if you do want to take any additional supplements, then we can make sure that we work around what is important to you and how that works with your medications as well. Commonly asked questions. The first one being menopause. So menopause, we see 4 important factors. Weight gain is a very common one, and that is because of the changes in our hormonal profile. Essentially, estrogen goes down, and estrogen plays a key role in heart health, in bone health, and because of the reduction in estrogen, we get something like hot flashes, which is your body saying, oh, something is deficient here, so I'm going to have a bit of a metabolic effect. So we're going to talk about weight gain. Perfectly normal to have weight gain, by the way. It is a normal process of menopause. Physical activity can help, of course. Eating a balanced diet can help, but it is really important for you to be comfortable with the fact that you are very likely going to gain a bit more weight just because of the fact that your hormonal profile is going to change. The way you used to eat before menopause and the way you're going to eat after menopause, if it remains the same, perhaps your body's going to react differently, and that's okay. But again, that's what the dietitians are here for. When it comes to hot flashes, I often get a question of, what if I eat phytoestrogen containing food? Phytoestrogens are found in lots of soya foods. And that could be soybeans, what's the word I'm looking for? Mung beans, there's another bean that I'm thinking of, chickpeas, things like that. Now, in terms of isoflavones, which is the kind of like the antioxidant found inside of these foods, they look like estrogen. And so they often bind to those estrogen receptor sites when your body's not producing that estrogen. Research is a bit out. Some research is saying it's actually quite helpful during menopause because your body has such low amounts of estrogen that those food forms of estrogen binding to those sites can help minimize the effects of hot flashes. However, some research is saying actually doesn't have an effect at all, and having an excess of estrogen of food forms of estrogen might not be helpful in the long run. So research is out. It's a little bit tricky to make very specific recommendations, but my recommendation is always a whole food first approach. So having a good amount of a balance between your whole foods like chickpeas and mung beans and actual soya beans rather than a tofu or a processed meat alternative that contains soy is going to be a lot better. Bone health, like I mentioned, calcium and vitamin D, they are best friends. So in fact, vitamin D is almost more important because vitamin D retains that calcium in the bones. Especially if we're not doing enough physical activity, vitamin D is there to kind of plaster that vitamin D in place. And heart health. So again, estrogen has a really important role in maintaining heart health. And when you are going through menopause, the estrogen is going to be a lot lower. So reducing saturated fat is one key important consideration. Omega-3s are fantastic. Omega-3s found in fish products, which also, oddly enough, contain vitamin D, so it's a good kind of pairing. That's going to be really important as well. And increasing your fiber. So that's where the whole foods come back in, considering the different forms of fiber. Just because you have something like a gastric outlet or bowel obstruction doesn't mean you have to completely remove fiber, like I mentioned before. It's just that the fiber type changes. Okay, so like I mentioned, phytoestrogens and cancer, it does have a similar structure and function, but it does respond in a different way. Research says that it doesn't behave like estrogen, even if it binds to those sites. So it might be protective against some cancers, given the fact that some cancers respond to low estrogen and some cancers respond to high estrogen. It's a bit of a tricky, it's a tricky field to swim through because the research is not conclusive. So again, when it comes to soy or phytoestrogens and cancer, I always recommend a whole food first approach and having a good portion, like 2 portions of whole food versions of whole food versions of phytoestrogens. Perfectly fine, perfectly healthy, and I would encourage it. One serving looks like 250 mils of soy milk or 125 grams of soy yogurt or some cooked soya beans. As you can see, I haven't put tofu or mock meat alternatives in there because I don't recommend it so much. But again, having those in small amounts is also perfectly fine. We just don't want to have an excess. Turmeric. Turmeric is a really good one because it's quite high in antioxidants, and there's lots of research around turmeric for things like osteoarthritis, joint pain, even brain health. So lots of different things that turmeric can be beneficial in. High doses of turmeric and especially supplementation can interact with some of your chemotherapy agents. So do be very transparent with your medical team about turmeric. And the main ingredient being curcumin, that's quite beneficial and powerful. But in terms of cancer, we don't have any conclusive evidence about whether or not it is helpful or not. So can't really provide a lot of recommendations there. And I know my answer here, it's not helpful in the sense of, well, we just want a yes or no answer. Is it good or should we stay away from it? unfortunately, I can't give a very transparent answer on that because there's just not enough research to back that claim. But it is safe to use in cooking. So do you use it in cooking as part of a normal healthy diet? Just in terms of the high dosages, just be very transparent with the team, with your wider medical team. Sugar and cancer. So sugar and cancer, this is probably the biggest theory or the biggest myth I get. It is well known that normal cells have differences in the way they respond to sugar. Cancer cells will often opt for very readily available forms of glucose. However, cancer is a very, very complex thing, and just cutting out sugar does not mean that cancer will necessarily stop using sugar and therefore goodbye cancer. It is a very complex system, and cancer does have different ways of accessing sugar, converting fat into sugar from your body, converting protein into sugar from your muscles and things like this. So cutting out sugar does not necessarily mean I'm starving my cancer of nutrition. It is very complex, but with that in mind, the ketogenic diet is something that I often hear about, which is let me cut down sugar to the bare minimum, where it's something like 5% of my diet and 20% protein and 75% will be fat. Now, this is a very, very hard diet to stick by, extremely tricky, and it can cause a lot of stress. A lot of distressful symptoms can come out of this, but essentially it's removing bread, pasta, sugar, milk, corn, beans, rice, any other excess sugar you can think of, going for things that are a bit more like your proteins, a bit more like your veggies, and a lot more of your fat. This is, again, very tricky. In terms of the research behind it, the theory is that it can be used by our normal cells, but not your cancer cells. The evidence behind this, though, is quite weak and limited. In fact, there are some studies that say that cancer, this is in conjunction with radiotherapy, that cancer continues to spread with the ketogenic diet. And there are some studies that say, the cancer is just not responding at all. So it's staying exactly the way it is before you start this diet. It's very weak and it's very limited, and it's only done in animals, or mostly done in animals. The ones that are done on humans are extremely tricky to pinpoint whether or not it's the ketogenic diet exactly. The population groups are very small. We need a very wide population group. We've got individual differences, our biochemical differences between ethnicities, genetics, the type of cancer we have, so many considerations to think of. So just in the back of your mind, if you think of the ketogenic diet, or if you read something about the ketogenic diet being necessarily the diet to stick to for cancer, just think about, okay, well, I wonder if there's research backing this. Is the research something that is a wide population? Who is involved in this population of people? Is it different ethnicities? What age group? What type of cancer? Lots and lots of things to think about. But the real short answer is that there's not enough evidence to back this diet. But again, as dietitians, we work with you and your individual needs. If you come to us and you say, you know what, Selin, I really want to work with this kind of diet and I'd really like you to support me through that, our role is to support you. And so if that's important to you, we will do our best to support you as well. Okay. And again, just in general, we don't want free sugars to make up a big part of your diet in general. No more than 5 teaspoons of added sugar is our general recommendation. Okay, so our summary here, I know we've gone through a lot of content and we've barely scraped the surface. And again, that's what a dietitian is here to do, to have these one-on-ones with you and support you and answer these myths and other questions that you'll very likely have, because the internet is a massive place. Aim for a healthy and balanced diet. Individualized advice is our key. We always work with each individual. It's going to be very different to your friend, to your colleague, to everybody else that's experienced cancer. And ensuring that you're getting information from reliable sources. I'll put up some sources at the end of this presentation. You might have some at the back of your pages at the moment. Asking an expert for advice. So again, myself, I work at the Guy's Hospital. So we have a cancer centre, and all of our patients have access to dietitians, especially if they're going through treatment. And if you're not going through treatment, or if you're in remission, or if you're in surveillance, then you can always see a community dietitian as well. And Yep, we always recommend following recommendations from good, reliable sources like the World Cancer Research Fund. So this, again, could be a little bit tricky to navigate. That's what we're here to do. So please do have a chat with me if you'd like some resources.